Welcome to Pelly Health's Pelvic Power Hour. I'm Kirsten Raker, co-founder of Pelly Health. Today we're diving straight into our discussion on pelvic health. But before we begin, let's quickly introduce our esteemed panelists. First up, we have Dr. Pam Downey, a doctor of physical therapy and clinical specialist in biofeedback for pelvic muscle dysfunction. Joining her is Dr. Lucien Alexandre, an interventional pain management and pelvic pain specialist with a PhD in neuroscience. Today, they'll provide invaluable insights into the world of pelvic health. Pelvic floor dysfunction affects a significant portion of the population, yet it's often overlooked and over-stigmatized. Today, we're shedding light on this crucial aspect of well-being, physical, mental, social, and sexual. So let's kick things off by delving into why pelvic health matters in the broader context of our everyday health. So, let's jump right in, and I would love for you two to introduce yourself. And as you do that, explain your roles in pelvic health and why pelvic health is important at a really basic level. Let's start with you, Dr. Downey.
Well, thank you for having me, and I'm glad to be a part of Pelly Health and getting this information out to interested people, because finding pelvic health is part of my mission so that people don't have to suffer. My background, I'm a physical therapist, board certified. I graduated from the University of Miami, and I have doctoral training. I'm ABD in my PhD, and I'm board certified so that in pelvic health. So that's something that I always say, you want to be looking for folks that have really chosen to stay in the realm of education and continue to supplement their education, because that's what you want to be, with someone who's current and up to date. So I treat folks from adolescents to octogenarians, and I see all different types of disorders around pelvic pain, incontinence, interstitial cystitis diagnoses, cancer diagnoses, post-prostatectomy work. And I also see women pregnant and postpartum, because that's a very important time for folks, as well as they go through changes of menopause, because then they'll have some issues around maybe dryness or other issues with bone health. So we're seeing these folks at all different stages in their life. And yeah, it keeps me busy.
It sounds like it. Definitely, especially throughout everyone's ages and stages throughout life and different health situations that we may encounter. Dr. Lucien, could you introduce yourself as well?
Lucien Alexandre, board certified interventional pain specialist and neurologist. I started my journey in pelvic pain really through fellowship in interventional pain management. Luckily, I was able to study under the tutelage of a great pelvic pain specialist at Beth Israel Deaconess in Boston, whose name is Dr. Nagda. I also had the privilege of working with one of the other pelvic pain specialists at Brigham and Women's Hospital, Dr. Velaskova, there. And then that gave me a sort of an introductory foray into pelvic pain. And then when I came down to Miami to practice, I realized that a lot of my colleagues simply were not interested and shied away. And quite frankly, once they heard the patient was coming in with pelvic pain, they usually give you the face of, I don't want to deal with that, just because of the complexities involved. And so I saw that as an opportunity to be able to provide a service to the community that, again, a number of my colleagues just weren't interested in doing.
Fantastic. Dr. Downey, can you talk a little bit more about what pelvic floor physical therapy is? And you touched on it briefly during your introductions, but also what certifications are required when people are looking for a PT? What are some things that they should look for? And then last but not least, we'll come back to it, but a question we always get at Pelly Health is pelvic PT covered by insurance? And I know there's a lot in there and we can unpack it little by little, but I think it's always good to level set. What is pelvic floor physical therapy?
physical therapists don't go in the same manner as, say, physicians, where they go to school for a certain amount of time. At the medical school level, for example, the PT school level is encompassing, and you graduate with a PT degree to practice as a generalist. And after that, it's up to you to focus on how you're going to specialize and gain that experience. So when you're looking for someone who is going to be a pelvic health practitioner that you're working with, you're looking for those credentials that they've pursued. And there are two bodies that really run most of the pelvic health education for clinicians that are out there practicing and licensed. One being the American Physical Therapy Association. It's called the Academy of Pelvic Health. That's where I have my board certification from. And that shows a minimum level of criteria that you understand how to approach complex patients, are well-versed in the internal exam, diagnostic and evaluative strategies from that, and then you can drive a treatment plan. Another group that has been along and really set the pace for education was Herman and Wallace. Holly Herman and Kathy Wallace are personal mentors of mine. I took my first course back decades ago, and the education has just evolved over time as we've gained knowledge, because our specialty will cross over other medical specialties like urology, gynecology, interventional pain management, family practice, pediatrics, so geriatrics. So these are things that there's a lot of crosstalk amongst the specialties, and you need to understand a little bit about what they're seeing and their subspecialties, as well as what you can offer as a clinician. So board certification is one way, but that's like the ultimate for people who are super committed. Then you have other folks that may have a specialty in physical therapy or other healthcare practitioners, and they can pivot to the Herman and Wallace education because it's open to all people that have professional licenses, and they can obtain a certificate and be a pelvic rehab practitioner. That's also something to look out for. So in the alphabet soup that follows healthcare practitioners' names, the PRPC can delineate that that person has taken the time to go through coursework and prepare for a national exam that then certifies you for those criteria to do pelvic health. And lastly, another nice thing to look for is if your practitioner has been in a residency program. So maybe a recent grad went straight into a mentored residency program, which is somewhere between a 12, 18-month program, and they're being mentored by clinicians that have been in the ranks for a while. So that ups your game when you're looking for that physical therapist or practitioner that has put the time and the energy in to solve problems around pelvic health.
It's so important that you just walk through that, because one, it can be alphabet soup, as you say, and really confusing and overwhelming. I know it was for me when I was trying to, navigate, who has what credentials and what do these even mean? So the other thing I would say is, and let me know if you agree, but patients should ask and see, not just look and read, but ask about the practitioner's background. Do you agree with that?
Absolutely, because then you can, I get very excited if someone asks me my credentials, because then I'm like, they're going to know that I've put the time in and I really understand what their condition's about. And more importantly, over the time, and we'll touch on this later, I'm trying to accumulate the practitioners that really fill out where my weaknesses or my needs for additional support and help. And that's essential because no one person can usually completely service the patient. So having that office without walls, as I call it, and people to reach out and refer to is super important, having that network.
Fantastic. And staying on the topic of pelvic floor physical therapy, a question we often get asked at Peli Health is pelvic floor physical therapy covered by insurance?
So I'll start on that if you don't mind, but insurance is a very tricky thing. The initial answer is yes. but I don't know too many people who are scrutinizing their medical health insurance for their physical therapy benefit unless they have a pre-existing condition that they know they're going to use it. And that's a very small minority of folks. So oftentimes, because of the nature of PT being mostly orthopedic, where you'll go multiple times and be supervised more in a group situation or not totally one-on-one, the medical model and the insurance model can come together there to deliver good health care. But we find that in pelvic health, you have to be behind a closed door. This is very intimate. There are intimate conversations about the history that you just don't want broadcast through a curtain or in a gym situation. So a lot of these offices have higher overheads, more time, and we don't get the reimbursement for the time that we spend with these patients. So oftentimes practitioners like myself, when you're putting in 45 minutes to an hour with each patient on each contact, you can't afford to deliver the treatment in the current state of insurance reimbursement. So although it's a bullet to bite, you might meet a professional out of network or that does not take insurance that actually can treat you more effectively and efficiently and help you with your problem getting to the answer more quickly.
Thank you for that insight. I think it's important for people to understand the construct of the healthcare system and still how critical it is to their health. And I realized it's probably good for us to level set and really just touch upon why is your pelvic floor so important? I think that's just the basic of that is something that we don't, as everyday people that aren't experts in the field, what does my pelvic floor do? What does it help me with? I'll start with you, Dr. Downey, and then Dr. Alexandre, if you would like to chime in on that as well.
Well, the pelvic floor, most people don't think about it at all until something's not going in the right direction, but it is one of the 4 basic core muscles. Along with your deep abdominal, these muscles of your back called the multifidi and your respiratory diaphragm. And the pelvic floor at the bottom basically keeps everything inside you and it's closes the holes. So for urination, defecation, for sexual function. So it's very, very much a beautiful part of everyday life. And we wouldn't be able to function without it.
Yeah, it's amazing that it's so critical to ourselves, yet we don't talk about it or get educated about it in our everyday lives. Dr. Alexandre, would you like to add anything to that?
I second what Dr. Downey mentioned in terms of the importance of the pelvic floor. We also think about it in terms of men, in terms of sort of prostate function, erectile function or dysfunction. In terms of birthing, it's a very vital structure within our body, and when it goes awry, as Dr. Downey had mentioned, most people don't think about it until it's not functioning properly, but then you realize, how important it is, and how much it actually affects your day-to-day life if you don't have a proper pelvic floor function.
So this is a nice segue into another question that we have for you both is, one thing that we hear at Pelly Health from women is it's too early. I don't need to worry about my pelvic health, or I don't have kids, so it's not an issue for me. Or, on the other side of that, it's too late. I'm already leaking, or I already am having painful sex. So there's this conception that it's too early or too late. From what we hear. So in your experience, what is the optimal time for women to begin prioritizing their pelvic floor health? And Dr. Dana, let's start with you.
So I would love to see pelvic health become part of primary care or of primary gynecological care for those that are seeking to see how their vaginal area is doing. So for those with vaginal issues and a vagina, as we would say, that information at that first speculum exam, there should be some, hey, this is the muscle that maybe makes you feel so uncomfortable when a speculum is put in there or during a bimanual, and to understand briefly the anatomy, the functionality, And even having a background or info sheet that then can list things like painful periods and what that means, what painful periods may represent as endometriosis later on, fertility issues, sexual function, urinary function, because you would be surprised how many younger women are leaking. There's multiple studies out on incontinence in elite athletes as well as general student body. So this problem is more pervasive than once thought. So beyond the pain component, where that drives a lot of people to seek treatment, there's a lot of functional things that we've just said, hey, you just put up with this, or wear a pad, or it's expected with aging. So starting at that first gynecological visit for young women would be awesome. That would be my goal. And then for young men, with their family practitioner, to know that, beyond a testicular torsion or sexual dysfunction, that there could be other reasons, including musculoskeletal and or nerve involvement that could accompany their pain.
Dr. Alexandre, would you like to add anything to that?
My role typically comes in not so much in the prevention or early phase. I'm usually the one who's brought in when things have gone awry and trying to find a solution, or at least a resolution to some of the pain and discomfort that comes with that. But yeah, I do see patients who come to see me, and it's more in the later stage, but you sort of look and go, maybe there could have been some prevention or something that had they been aware of. For instance, I have cyclists who come in and they have injuries from cycling, and so some of that knowledge, had they known, probably could have prevented some of these issues, so they wouldn't have to come and see me in the first place.
So staying with you, Dr. Alexandre, and this, is it too late? Is it too early? When should individuals seek specialized care with a physician like yourself in pain management? And what should they look for? And I bring this up because, especially in women's health, there is women's pain is often dismissed. So it's crucial to ensure that they receive the support and attention they need. But given that these are challenges women are facing with their dismissal of pain, it's been written about the gender pain gap as well. How can women advocate for themselves better if their pain is being dismissed? And then what should they be looking for in a physician?
It's a central question that I think a lot of, not just for pelvic pain, but women's health in general, and also certain marginalized groups tend to find, in terms of, does my physician take me seriously? Is what I'm saying being heard, and am I not being dismissed and thought of, okay, it's just an issue that you can deal with. Don't worry about it. It's not important enough for me to think about. Typically, I think these conversations should be had with internal medicine specialists, your primary cares, your family practitioners, the gynecologist for sort of well care visits. And I think in terms of what one should look for is what I'm saying being received, and am I being taken seriously? I think oftentimes, especially I think from a physician's point of view, because our visits have gotten cut so short in order to try to make ends meet, as Dr. Downey had mentioned, what physicians typically end up thinking about, okay, you've got diabetes, you've got high cholesterol, you've got hypertension. What are the things they're going to kill you? I'm going to focus on that. Oh, yeah, you're having some issue with with urination or sexual. Yeah. That's not that. Okay, we'll talk about that some other time. And what happens is that gets pushed to the back burner, never gets addressed. Or sometimes it may be that, yes, they hear you, but they just dismiss you. And there is such a thing as medical gaslighting, where you present with a condition and you're sort of being told or felt that what you're feeling doesn't really exist, and it's all in your head. You're just stressed out, or it's the kid. You're not sleeping enough. It's your menstrual cycle. It's your premenopausal, postmenopausal, introvert. It's all of those things, but a lot of times never really addressing the real issue. So I think finding a clinician or someone within the staff, because sometimes it may not be the doctor themselves, it may be a nurse practitioner or a physician assistant, but finding someone who's one listening to you and you're getting the feedback that, okay, they're taking this seriously, they're going to take the time to address this. Yeah, in terms of when someone comes to see someone like me, again, I usually come in later. If there's enough prevention and if this is taken seriously, again, a lot of times patients don't need to come in and see someone like me. But when they do, the things that someone wants to look for is, one, does the doctor that I'm going to, do they treat this sort of condition? As I mentioned earlier, a lot of my colleagues are not that keen to treat pelvic pain, and one, it's because it's complicated. Dr. Downey can tell you there are lots of muscles in the pelvic floor. There are lots of nerves that run through the pelvic floor. It is not always that easy. There's also a biopsychosocial component to this, right? We focus on the biological, but there is sometimes a psychological either overlay or a psychological sort of penalty, if you will, from having some of these conditions, and then the societal or sort of the interrelationship sort of aspects that come into play as well. Because it gets so complicated, a lot of people say, I just don't have time. It's too much. It's too complicated. I'm not going to, go see somebody else about this. And so when someone is looking for a physician, they want to make sure that it's someone who's dealt with this, someone who's willing to deal with it, and has a track record in doing so.
Fantastic. Let's stay on this track a little bit here. And I'll just drop a little anecdote of mine. What was part of the inspiration for Pelly Health is I went to 4 different OB-GYNs, and it took me 4 doctors to get to a point where one was truly listening, that I felt listening. But before that, I was told, oh, just have a glass of wine and your pelvic pain will go away. Just relax a little bit. And unfortunately, that can deter many people from continuing to seek help. So I think your words are really important, Dr. Alexandre, in terms of what to look for, and also to not just give up, which it's easier said than done, especially when you're experiencing or quote unquote in pain or leaking, and it's affecting your mental, social, and psychological self. But Dr. Downey, I'd love to talk to you a little bit about, you've likely encountered people sharing various stigmas and misconceptions or instances of gaslighting surrounding women's health and pelvic health issues. Can you share any examples of that that you've come across in your practice, and discuss how these challenges are affecting your patients? And then how do you work with them to kind of reinstill confidence that there may be a path forward through pelvic care?
Yeah, I think Dr. Alexandre brought up the fact that you have to find someone, and it doesn't have to maybe be that primary physician that you're seeing, or the person in, like, you went to multiple folks before they said, oh, there may be another answer for you besides a glass of wine. Because I'm shocked that 25 years into this, I have people coming in saying this is what they were told, that you're just uptight, you're too stressed out, you just need to go home, have a glass of wine, and just get out of your head. And lo and behold, that, I always say, does your pelvic pain make you crazy, or you're crazy and you get pelvic pain? Well, there could be a couple of those, we don't know. But oftentimes there's a real literally palpable reason that you're having the pain, or there was a traumatic event which then set off a portion of that biopsychosocial component where it's manifesting in the pelvic floor. Some people have GI issues. Some people have migraines. Some people have TMJ, TMD. So people put stress in various locations, but some are more socially acceptable to be spoken about, and there's therefore more help. When you can talk about your jaw pain or the fact you wear a device at night to help you with your grinding of your teeth, but I don't know too many women that are at cocktail parties going, penetration's really uncomfortable for me and I'm really having a hard time with that. What about you? That's just not what we hear. Or my gentlemen that have been suffering for months after a prostatectomy and they're having erectile dysfunction. They might be leaking at inappropriate times according to them. And everyone just says, just give it a few more weeks, give it a few more months. But there's a point where the person's going to lose a little hope or feel like, wow, I'm not being heard. So that's a big one. And when they can come in and we can, identify the problem, we usually can make some change on it. And then if we start stalling, that's why I love the collaboration. I actually happen to love my collaboration with Dr. Alexandre because for years, I didn't have good pain management. Because even though I had a lovely referral network, a lot of the folks that were sending me the patients didn't want to start writing for prescription medication that maybe wasn't typically associated with their specialty. They didn't really know there's a lot of liability with that and knowing how to treat the patient through, and polypharmacy, which means you're taking many drugs maybe, and what's the interaction of putting another medication on top of that. And so it's wonderful to be able to work with someone who understands that and can pull that piece and then allow the patient to get control, which for me, establishing the patient as the person who controls their pain, and there's many ways to get at that in neuropain science, but having someone that's on your team that can help lighten that pain or create control through being able to take a medication that allows me then to help them move through their musculoskeletal dysfunction.
Mm-hmm, mm-hmm. So staying on that track, obviously Dr. Downey and Dr. Alexandre, you two different fields coming together to treat a patient, to help them find relief. I want to talk a little bit more about the different specialties that can come together to treat pelvic floor dysfunctions, and maybe also kind of touch in there upon who those other specialties might be and what common issues might be treated. And I think it's really important for people to understand, and I know we touched about it a couple times, that it really does take a collaborative approach. So it may not be a one-stop shop. And if you kind of think how we're geared, especially here in the US, is like, I hurt my hand, I'm going to go see the doctor for my hand. I hurt my foot, I'm going to go see the doctor for my foot, my heart, right? It's very siloed approach, even the way we think about treating and taking care of our own bodies. So I think talking about the multidisciplinary involvement would be really great. And maybe Dr. Alexandre, we start with you, and then Dr. Downey, please jump in as well as we go through this question.
You failed to mention I hurt my pelvis. I'm going to go to doctor for my mouth. That doesn't exist.
I think because people are confused about that one. Where do we go for that? Yeah.
So there are sort of many roads that lead to Rome in a sense with this, right? I interacted, let's say, from the medical perspective with many different specialists, whether it be colorectal surgery, sometimes even my oncology colleagues. I've seen patients with pelvic pain from pelvic tumors. Your gynecologists, your urologists, your urogynecologists, your internal medicine docs, your family practitioners, some even orthopedists. If what was thought or believed to be an orthopedic hip issue ends up being actually something else. So there are many different specialists who touch upon the pelvic region, and it's not owned by any one specialty, and I think that also makes it confusing for patients. It's also confusing for other docs, right? Because sometimes I got a text message yesterday from one of my urologist colleagues who said, "Hey, I have a patient that I did a hernia repair on, and they're having pain, but do you treat that?" And I go, "Oh, absolutely, I can help you with that, but even then, some of the specialists aren't even sure when they run into a problem, who do they reach out to get help. And it can be complicated. So imagine if it's complicated for physicians, how complicated it must be for the patients when they go, I don't know where to go with this. And so within the medical profession, there are lots of specialists who touch upon these. And then interventional pain as well is one of the ones I did mention. And then outside of medicine, you have your pelvic floor PTs, which again, for years, I bless Dr. Downey for saying, okay, I have someone I can send you to. And even when patients go, but I live in Broward, I go, no, but you better go see this person, because you don't want to just see a physical therapist. You want to see somebody who is going to be able to fully understand, diagnose, and treat you. And so that's incredibly important. More when I was in training, less so in nowadays, and I think a little bit of this is changing, is also psychologists. And the reason is because finding psychologists who were equipped to do to see patients and do biofeedback with patients, guided meditation with patients. There's been a dearth of that, and especially in our region in South Florida. But I think since the pandemic and the ability to talk to a practitioner via telemedicine, or whether it be through Zoom with a psychologist or therapist, I think that's also been incredibly helpful, because I think that part's also ignored. And so there again, and I'm probably missing some, maybe even through my own ignorance, there are other specialties that probably come into play that are involved in this as well.
Dr. Downey, anything you want to add to that?
Yeah, collaboration is key. And again, going back to the specialties that I interact with most, they may never have been exposed to physical therapy in their training. So sometimes they don't think, like, how does a PT fit into my practice? In fact, early on in GI aspect, colorectals know a lot about PT because the levator syndromes, pain, they see a lot of that with defecation disorders. So they know that PT has the musculoskeletal chops, and bringing up biofeedback, there's biofeedback for the pelvic floor. So there's that specialty training that we undergo to treat them. So that was an easy conversation, like for me to have when I was starting out, about how I could provide services. But I'm sure I got some strange looks from others beyond, maybe simple Kegel exercises and the fact that we do internal releases, dilator work, and things to help with range of motion of the vaginal and anal openings. So those folks don't see how we fit into their mix, because they may not even know that we exist in the first place. So that's an important thing. And I think social media and the internet has vastly changed that for the consumer, because you can look things up now, and even through this venue and what stands for Peli Health, to get this information out there. So collaboration is key. Nutritionists, I'm going to reach out to the folks that want to be with those patients to begin with, as Dr. Alexandre said before. That's key. You have to have someone who has an interest, because it is a calling, I say. And the nutritionist, the psychologist, I've just come in through COVID, we had a little more downtime in a way, but I was able to follow up with busy professionals and find out exactly what they like to treat within their practices. And lo and behold, I spoke with a psychologist that did all of her advanced work in traumatic birth issues. So her specialty was in that, and that opened up a whole conduit to get the people to the right person. And then if her trauma base was in exactly that, then she knew where maybe sexual trauma folks would want to be treated. So that helped me then go to that next step. So I think it's really important to have collaboration, psychology, nutrition, the specialties within the medical professions. And also the folks that send me a lot of patients are the people out in the front lines, yoga instructors, Pilates instructors, because their patients will be like, their clients, or they're the people that are taking their work. they'll notice that they have to pause to go run to the bathroom, or they see that the patient is, or the client is not able to do something very straightforward, and they may have a diastasis recti from a pregnancy from a month or years ago that is not resolving. So it's not all about the folks with the alphabet soup sometimes, but it's the observant person who's maybe at a personal interest or a personal event, and they've seen what can be done. And I find that those folks are so helpful in getting the person that they're working with to the right practitioner.
Yeah, I can see that, especially, being an athlete, or as you said, yoga or Pilates, you're so focused on your body. You have to be body aware. So you probably
Yes.
start to notice those changes. I'm starting to also see pelvic PT partnerships with CrossFit gyms. And I think there was recently an article about athletes, including CrossFit athletes, and the rate of incontinence, to your point earlier, being very high. So that's a very interesting point. Going back to never too early, never too late. I don't have kids. You can be an athlete and still have some challenges. So switching gears a little bit, I do want to touch really quickly, Lucien or Dr. Alexandre, on how does pelvic pain impact the overall quality of life for someone? And what are some strategies you recommend for managing pain-related symptoms? And I think this is an important follow on to the conversation we were just having regarding all the different specialties, especially psychology, mental health. You mentioned trauma, all these things. So, Dr. Alexandre, can you talk about that a little bit, and maybe also just briefly touch upon, without going into the weeds, in layman's terms, some things that you may treat that you see related to the pelvic floor?
Again, because typically the patients that I usually see for the most part tend to be dealing with chronic pelvic pain. I see these patients coming in, and some of them are shells of their former selves, and they'll tell you that because of the pain that they're experiencing, that they are unable to work, right? Just because they can't sit for long enough, or they, very uncomfortable positions for them. They have poor relations with their partners because they can't engage in sexual activity. Their sort of levels of depression tend to be incredibly high because of how this has affected them, and just not allowed them to live their normal lives. So in terms of the impact of chronic pelvic pain on patients' ability to function and to lead sort of normal active lives, it's actually a fairly significant impact. I think you had also asked about sort of treatments that patients can do on a day-to-day basis. Now, again, one of the things that Dr. Downey mentioned when we work together, sometimes I do incorporate for patients use of antispasmodics or muscle relaxers. Sometimes that helps them with these flares that they'll have. Right? Let me tell you, for the most part, I can get by certain parts of the day, but there are these moments where I am just miserable, and some of them have to go to the emergency room to try to get pain relief. And so trying to keep them out of the emergency rooms, and so that they're not having to suffer, and giving them medications to try to help them through those periods of pain flares, I think has been helpful for some patients. Other things, sort of simple things, and it may be silly, may sound silly to some patients, but sort of seating, for instance, I may say, look, have you tried using a donut seat? It's not something like it's not high tech. It's low tech, but it works for some patients depending on what sort of condition they may be presenting with. So those are some of the more day-to-day things that I may suggest. In terms of my approach, is I usually start off with a more conservative approach. A lot of what I do deals with a lot of listening and trying to figure out what is the medical history, what is it that they're the person is telling me that they're feeling, and then I'm trying to figure out which pathway may be causing this. Is there a nerve, or is there a muscle? Is there something that may underlie that person's presentation, and trying to figure out, okay, can we start off with the medicine? Do I have they done pelvic floor PT? Most of the patients that come to me with chronic pain complaints, usually I'll tell them, look, if you haven't tried physical therapy of your pelvic floor first, let's start off with that before I do anything. And again, I may supplement with a medication as a first line. And then once they've done, or if they're still doing, or once they've done pelvic floor physical therapy, or if they tried these more conservative measures, whether it be an oral medication or a suppository, if those things have failed, then I start thinking about more sort of interventional pain procedures. How can I intervene? Is there a pathway that I can abrogate to try to see if I can give them some relief? And so that's the way I approach it. But it's usually, again, let's try simple things first before we start getting into injections or procedures for pain control.
I want to switch gears a little bit because we've touched on a few things throughout our conversation, and there are, Dr. Alexandre, you said there are some of your colleagues are kind of not wanting to dive in and treat pelvic floor dysfunctions because it is complicated. And Dr. Downey, you mentioned that some professions just aren't really that knowledgeable of some of the nuances in pelvic health. And so given the differences in your training paths, could you each address some of the educational gaps in our healthcare system or practitioner training, maybe that you even saw as you were going through your many years of certification? I don't think that that's fully understood. And so if you wouldn't mind, maybe Dr. Downey, we start with you to talk about some of the gaps even between pelvic PT and OB-GYN and the knowledge of pelvic floor dysfunction and treatments. Maybe we start there.
So gaps in knowledge, knowing what a PT does. So I think that's one thing that we need to do a better job, is to reach out into our community and let them know what we do. And people with, that may, down here in Miami, there are a lot of folks that go skiing and snowboarding, for example, and they may fall and they hurt their tailbone. They may not hurt their wrist, but they may also hit their tailbone. And dollars to donuts, they're probably going to get good referral for the wrist pain, and treatment, but that coccyx pain may never be addressed. And it may, they're like, I don't know what to do with that, and so again, gaps in knowledge of how to access PT. So one organization, which I'll bring up now, and I have nothing to gain by when I bring out these organizations, the International Pelvic Pain Society is literally that. And it's individuals that are interested in treating pelvic pain. And that organization has done so much to reduce the gaps and to educate the other practitioners in the room about what they do so that we can be more collaborative. So if you're looking to find someone, I would look at the IPPS.org website, pelvicpain.org, that's going to give you an idea of who's in the hunt. And in there'll be physicians, PTs, nurse practitioners, sexual counselors. There's going to be a whole myriad of specialties that normally you would have many gaps, but they will be there together. So that could be a nice solution for that. Another organization is the International Continence Society, and that alone is, again, an international body of folks coming together to raise the bar on examination treatment for individuals with different continents, but also pain is within that. So that's another organization with far reach. And then at the more concentrated levels, if, say, you're diagnosed with vulvodynia, or a GI, functional GI disorder, look up the organization with the actual name in the title, like the National Vulvodynia Association or the Interstitial Cystitis. And you will find then find a practitioner. And that will help get you in the realm, even if someone's not in your state or locality. Oftentimes we're like, okay, I'm not your person because I'm 400 miles from you, but why don't you speak to so-and-so and look on this website and get their contact information, or I give them the direct information. And that can help start that linkage to get to the right folks. So maybe I'm not exactly answering the question about gaps, but it's about eliminating the gaps and going to these organizations like the ISSVD, Ipswich. They're really out there, but talk about niche or not on the giant stage. So you do have to do your homework.
I think that's so important, and you are answering the question, because it is an educational gap for the patient, for the individual, but it's also right. They may not get that recommendation or the direction that you just gave from the physician that they're seeing. So I think it's so important to point out those organizations, because as you say, they're not, billboards everywhere talking about these organizations.
Yes. Mm-hmm.
Dr. Alexandre, let's switch over to you on this question. And I'm curious to know, as you were going through, medical school, and I do know you mentioned in your fellowship, you were able to practice under a pelvic pain specialist. However, as you were going through your general training, is there a lot of time spent on pelvic health? And if so, or if not, when did you start to become aware of it? And if not, how do you, what's your view on that? And how do you change that?
Training through medical school and residency, is there a lot of time spent on pelvic health? The quick answer to that is no, absolutely not. If you happen to get lucky and you happen to be in a room that happened to have someone complaining of pelvic health, then maybe. But it certainly has not been something that has been presented in our medical education as a top priority. And I think the one solace that I find is that I think that there's more and more of an acknowledgement of just women's health issues in general, and pelvic pain or pelvic issues being part of that I think is starting to get more and more attention, although woefully inadequate attention. But still, I think we're starting to notice some progress in that direction. But I will tell you that, as Dr. Downey mentioned, that if you're not interested in a particular topic like pelvic pain, when it comes to women's health in general, if you're not interested in something, you're probably not going to have someone give you that information. You kind of have to seek it out. Even as during my fellowship, although I had the opportunity to work with some great physicians who were interested in pelvic pain, but that still paled in comparison to what I was exposed with when it comes to patients coming with back pain or neck pain, or they have a sciatica. You see a lot of those, and you every now and then you'll see these zebras. That someone comes in and they've got a pudendal neuralgia, and you're like, oh my God. And then you spend some time focusing on that. And so, I think, more and more, as I mentioned, yes, we're being exposed. And I do think that for physicians like myself, I'm still learning every day. I go to conferences, and I'm starting to see more discussion about pelvic pain conditions at some of these conferences. And I think that helps to not just educate me, but also my colleagues on things that we probably weren't thinking about before. I'll give you an example. I remember several years ago, I went to a interventional pain conference, and one of the speakers was talking about the role of endometriosis in causing back pain. And I thought about it. I was like, well, well, you think about it in terms of menstrual cycles and the pain associated with that, but then these sort of these satellites of endometrial tissue in other parts of the abdomen, and then you're thinking, oh wow, that I've never thought about. Can someone's back pain be from endometriosis itself because you've got this satellite tissue there? And this was several years ago, but opened my mind to making sure that I take that into consideration. And so I think having this exposure starts to make you think of other things that you didn't know were possible before that now become possible. Once they become possible, then they become things that you start thinking about when you see your patients, and you think, all right, this may not be a common issue, but this is still something I'm going to think about. This is something I'm going to put in my differential. And, if it's not A, B, or C, then it still may potentially be this D. But if you don't know that D exists, you're never going to, bring that up with your patient. Or sometimes I have patients who are really smart and they bring things up to me and I say, you know what, again, may not be the most common thing, but we're not going to dismiss it, right? We're going to keep that into differential. Let me try these other things first, but let's certainly think about this as well, right? And so you need that partnership because again, I know many things, but I don't know it all, right? And I do take that feedback from my colleagues like Dr. Downey or patients who come in, and I think if I say one thing for patients, advocate for yourself. If you know something is amiss and you're hearing, oh, it's just this, or just drink some wine, and you go, that's not right. I know something is wrong. I know I need help with this. Find someone who's going to listen to you. And again, who's willing to say, let's go through this journey together and let's figure it out.
Yeah, it's almost mind-boggling to me. I mean, I obviously do not come from the field of medicine, but it's mind-boggling to me as a patient now, knowing after my own issues how critically important the pelvic floor is, to know that it's not, I guess, in the training of a physician, it's not focused on. But it also explains some of these frustrations that you may have as a patient when you start to have these issues and you go to a doctor, and they to your point, they may not know what these conditions are or the treatments are. And so making sure you get to the right physician through those organizations that you pointed out, Dr. Downey, is really critical. My last question for you both, as we kind of round out the conversation, a little bit more rapid fire. We like to end on a positive note here at Pelly Health. What do you envision changing or improving in the realm of pelvic health in the near future, or what are you most excited about that's happening in the realm of pelvic health right now? Dr. Downey, let's start with you.
Well, hands down is educating the public, even if it's on a one-to-one basis as people come into the office or through events like this one. Getting out there, having people who start Facebook groups, the chat at the public level, individuals reaching out and helping each other get to the right place. Because I learned so much from my patients, and that's how, by listening, that's how I'm honing my craft, is by solving problems of activities of daily living a lot of the time. So I'm really excited about that. That is a huge shift within my career, because there was no internet when I started. There was no social media, and I've seen the change, and things are a lot better. I have patients walking in the door directly saying, I looked you up, I hear you do this, what can I do to help myself? And that's a game changer. So I'm super, super excited about that.
Dr. Alexandre.
So I think platforms like Pelly Health are incredibly important, and I think that's changing the field. Kudos to you, because this is part of that innovation and patient education that I think that's incredibly useful, and that's needed, and patients are seeking this information. It's not like these things are new. They've had these questions. Maybe they're too shy to ask, as Dr. Downey mentioned. It's not a conversation starter. But now patients have the opportunity to go and look online and say, okay, I'm having this problem. Who else is having this problem? Where can I get information? And then there's a lot of that's out there. So I think that's incredibly exciting. For me, as an interventional pain specialist, some of the treatments that we have been very helpful. And again, I wouldn't recommend this for someone who has an acute pain issue or hasn't tried physical therapy or certain medications. But for those who have debilitating chronic pelvic pain that feel as if that there's no hope and that they've tried everything, some of the treatments in relation to being able to use little wires temporarily placed next to a nerve, sort of re-educate that nerve to function appropriately, and then remove the wire so that there's nothing implanted in the patient on a permanent basis. That's been, for me, I think that's a game changer, because before we used to burn the nerve or freeze a nerve, and it never sat right. Why am I destroying a nerve to try to give someone relief when you can do something like a peripheral nerve stimulator and give a patient sort of at least a good portion of their life back? Doesn't guarantee 100% relief, but that's something that I'm passionate about, and I think I'm very excited about.
Fantastic. Well, Dr. Downey and Dr. Alexandre, this has been an enlightening discussion, chock full of all types of information and inspiration for people who may be suffering and or looking for help. I want to thank you both very much for spending your time and sharing your expertise with us here today.
Yeah, thank you for hosting this. This has been great. Yeah, thank you.
Yeah, thank you so much for creating this venue with Pelly Health so that people can find those answers and walk in those doors and ask those questions. So that's really awesome. So thank you so much for letting me be a part.